All right. Hello, hello.
Hello.
Yeah, let's just wait a few minutes for people to pop in. Do you drink coffee
Yeah, I do.
or do you prefer tea?
No coffee.
Coffee.
Cuban coffee in the morning.
You like the Cuban coffee?
Yeah. Only when I'm here, actually. At home, I don't.
You don't make Cuban coffee? What is the Cuban coffee? It's just like espresso?
No, it's like this is how you call it?
I'm not Cuban, I don't know.
It's strong black coffee. You do add some milk too, but it's stronger.
Okay. I've tried it, it's good.
Yeah.
Hello, hello. Happy Tuesday, everyone. How's everyone doing today?
Hello.
It's a little bit slow. Hello, hello. Thank you guys. All right, we are here with
Dr. Dang.
If you guys have any questions for him, please go ahead and send them in the comments. If you have any concerns, any doubts, he'll be able to address them. All right, if you guys have any questions, all right, don't be shy. Don't be shy. All right, we see a few people popping in. There you go, there you go. Perfect. All right, so let's go ahead and get started. How are you doing today?
Awesome. We just finished few cases, and so we just have some time to kind of share with you guys.
Awesome. What did you do today?
A couple BBLs.
BBLs. Okay, awesome. Very nice, very nice. All right, so guys, go ahead and ask any questions for Dr. Dang. All right, so let's get started. Dr. Dang, I'm wondering if I have to lose weight before my surgery because I have a high BMI. Is this a problem?
I always say that every patient is individualized, and so I don't depend on the BMI alone to see whether you're a good candidate for surgery. But certainly, if you're in the high BMI range, it certainly would help if you lose some weight. Yes.
Awesome. Okay, thank you. Real quick.
And it's not just for the procedure itself, but for your own recovery and health.
Of course, very good. All right, thank you. Real quick, I saw that on TikTok. It said that it was filtering some comments. So if you guys sent a question or a comment and we didn't see it, please go ahead and resend it, maybe using like different words or something so TikTok doesn't restrict it, all right? Thank you guys so much. All right, let's keep going. Dr. Dang, I'm loving your results, but I want to travel. Is that something you recommend?
You can travel to us?
Yes.
Yeah, we have a lot of patients from out of town actually, and that's not a problem. You just have to work with us, and you have to be here for about a week after surgery just so you're safe to travel home. But we service a lot of patients out of state, so that's not a problem.
Perfect. Any like recommendations that you give them if they're going to travel?
I would try, you can travel with a friend or someone who can help take care of you afterwards. That would be ideal, especially when you're traveling and having someone to help you with the luggage and stuff like that. Not only that, but during your stay here, it'd be nice to have someone. Okay, so I think that's probably the number one thing I would recommend.
Awesome. I didn't even think about the luggage. That's very true. That's
Yeah,
very true.
you can't be lifting like 20 pounds.
Right. Okay, perfect. Okay, so Dr. Dang, I have diabetes type 2. Is this going to affect my procedure?
If it's well controlled, then no. But you need to control your blood sugar. Okay.
Perfect. Thank you so much. All right, guys, don't be shy. Don't be shy. If you guys have any questions for Dr. Dang, please go ahead and take advantage of him right here. There you go. We have one. Dr. from Sin, Dr. Dang, do you do implant extraction?
Yes. We do implant extraction, implant removal, capsule removal. We do them all.
Perfect. Thank you so much. Sana Hussein says BBL 3,750.
That's what
There
that
you
says.
go. All right, so take advantage. Let me send this real quick. If you want to go ahead and book your free consultation with Dr. Dang, go ahead and send us here your full name and your number, and then a coordinator will contact you, and just make sure that you tell them that you want to book with Dr. Dang.
Yeah.
Okay?
Tell them you want Dr. Dang.
Of course. Very good. Okay, so Dr. Dang, I am wondering about my recovery. How long after my BBL do I have to use the pillow?
Oh, the pillow to sit on? 6 to 8 months. I mean, sorry, 6 to 8 weeks.
It's a long time.
Yeah.
Okay, very good.
Yeah, you don't want to sit on your buttock too soon because you want the fat to survive.
How long do you recommend after your BBL not sitting at all?
Usually a month, and then after that, use a pillow for another month or so.
Perfect. Okay. So yes, so for example, Santa, who is interested in the BBL, just make sure you take that into consideration. All right. All right. I have so much loose skin after my kids around my belly area, and I am frustrated with it. Do you recommend any certain procedure?
Yes. I mean, we do a lot of patients with that same problems. And so if you have excess skin, we recommend to do a tummy tuck. And then of course, if you have other issues and stuff like that, then we can always evaluate and then recommend different procedures or combo procedures to kind of give you the look that you desire.
Perfect. And what exactly is a tummy tuck? If you want to explain that process.
Tummy tuck is basically where we take out the excess skin from your belly. Usually you have a belly that hangs over your belt line, whether it's above the belly button or below the belly button or both. That will dictate which kind of tummy tuck we do. But in general, we remove all that excess skin, okay? And then we also do some liposuction on the side to kind of give you the shape that you used to have or you never had, then we can give you a better shape too.
Awesome. And then I will chime in here. Guys, for Black Friday, Dr. Ding has an amazing special on the tummy tuck, okay? So if you guys are interested in that special, his tummy tucks is at $3,500 just for Black Friday. This is just for Black Friday, okay? So take advantage, and if you're interested in a tummy tuck, go ahead and book that consultation.
That's a good price.
It is a very good price, so take advantage, guys. Take advantage. Where can I see your results, Dr. Ding?
You can check out the Instagram page, or either on my page or on Icon Cosmetic Center page, and you see some of those.
Okay, perfect. So on the Icon, and then do you have a Instagram as well?
Yes, Dr. Quoc Dang, DrQuocDang.
Perfect. So make sure to follow
Follow
him.
me.
Perfect, great.
You can contact me directly on there as well.
Okay, cool. Very good. Okay, I want a mommy makeover, but how do I know if it's the right procedure for me? I've had multiple kids, and I really changed.
It all depends on how your body looks like. I have to see you to really tell you what you need, okay? But for a mommy makeover, we typically do a breast lift and a tummy tuck at the same time. Or we can do a breast implant with tummy tuck. So it's basically breast and tummy.
Perfect, okay. Very good. Dr. Dang, I am from California.
Me too.
Really?
Yeah.
Oh, no way, okay.
I grew up in California.
That's very cool, I didn't know that. But I love your work. Can I book a virtual consultation?
Anytime. You can get a virtual consult anytime. Okay? And then you get to talk with me. I'll get to see you, and then we can talk about what you want to do. And then if you're going to move forward, then I see you here in Miami.
Perfect. Awesome. Okay, so again, guys, how do you book that free consultation? It can be virtual or in person, right there. Full name and number, and then just let them know that you want to book with Dr. Dang. Okay. Yeah. Do I have to add the J plasma?
You do not have to add the J plasma, but a lot of time we recommend it because it helps to tighten your skin better, gives you a better result. But no, it's an option that we strongly recommend to certain patients.
Okay, awesome.
Okay. Depends on your skin, how lax it is, how stretchy it is, and depends on that, then we'll recommend it. But it's up to you.
Okay, perfect. And what is exactly the J plasma?
It's actually a device that uses heat, and so what it does is when we do your liposuction, we insert a device. It's kind of like a little stick, and it is connected to electricity source, and it uses gas to kind of heat up the gas. And then it heats up the skin from underneath, and so it helps to tighten up the the basic structure of your skin, so then you have a better skin tightening.
Awesome. So it gives very nice results.
Yeah.
All right, perfect. Dr. Dang, I like this question.
Yes.
My procedure is in December,
Uh-huh.
but I really want to drink wine this Thanksgiving. Is this okay?
Yes, it's okay. Yeah, it's okay. You can drink until when you come here.
Okay.
That shouldn't be a problem.
Okay, perfect. All right, thank you so much. What is your number one tip to be prepared for the day of my procedure?
I would say have a good night rest the night before. Stay hydrated. I think that's one of the most important thing to kind of get your body in a good condition for the surgery and for healing afterwards.
Perfect. Okay. Let's talk about, I think I asked you this before, nail polish. Should you remove your nail polish, your acrylic nails?
Not necessarily. There's different ways. The reason we're talking about that is that during the procedure you'll be under general anesthesia, so you'll be told to sleep. So we have to monitor your oxygen level. And the way they do that is to put a little clip on your finger. And sometimes the nail polish or the acrylic nails, they can get in the way of that. But there's different ways to do it. Sometimes we use the earlobe. And so I don't think it's necessary.
Okay, very good. Okay, what about piercings?
Piercings. You do have to take off your piercings either in the pre-op area here, or you want to take it off on your own, that's fine too. But yeah, we usually would like for you to take off your earrings or jewelry. That's just in any surgery.
Of course. All right, perfect. All right, guys, if you guys have any questions, you're a little bit quiet, go ahead and send us your questions. Dr. Dang is very educational. He's very, very good at explaining.
Maybe they know everything already.
Maybe. All right, and if you guys have any questions about his, very good at explaining.
Maybe they know everything already.
Maybe. All right, and if you guys have any questions about his prices or anything, go ahead and ask that as well. All right, so when can I go back to the gym after my procedure?
Usually 6 to 8 weeks, depending on what procedures we do. But I would expect 6 to 8 weeks.
Perfect. Do you recommend that they stay active though right after the procedure?
Yes. Just because you can't go to the gym doesn't mean you can't stay active. Walking is one of the best thing after surgery. It's good for healing. It's good to prevent complications afterwards.
Awesome. Okay. Very good. Very good. How much time should pass until you start walking?
The day after?
There you go.
Yeah.
I'm like, did that make sense? Yes.
Actually, even the day of the surgery, right after, you should be able to walk already. But we like you to walk right away.
Perfect. Thank you so much. All right. I find the compression garment very uncomfortable. Do I really need this?
Yes, you do. Everything about surgery is going to be uncomfortable. And that's just a matter of fact. The price you pay for beauty. But I think it's a good price to pay.
Yeah, for sure.
Yeah.
How long should you wear your compression garment? How often?
Basically, you wear it all the time. At least 6 to 8 weeks.
Okay, perfect.
It just helps to at least 6 to 8 weeks.
Okay, perfect.
It just helps to kind of shape your body. It kind of enhances the procedure, So you want the best result, and that will kind of help you in that regard.
Perfect. All right. So compression garment, very important.
And massages.
Let's talk about the massages.
Yeah.
How often? I get these questions a lot actually. How often do you need to do your massages?
In the first week, every day. And then after that, 2 to 3 times a week for about 6 weeks.
Okay. And do you have to come here? Do you learn how to do them? How does that work?
For patients who come here, it's probably better for you to do it here, at least in the first week. Because then we can see you post-op, and then you can just get your massage at the same time. Or if you have your own massages set up, you can do that on your own, especially when you get back to where you live. And if you learn how to do it, you can do it yourself as well. It's not that hard.
Perfect. And then I had another question with that. Why are the massages important?
Number one, it feels good. Number two is to help kind of mobilize or to move the fluids, because usually after surgery, you're gonna have fluids accumulation. That's just a normal process, inflammation, and so it helps to kind of move the fluids around and drains the fluid, and so it's just kind of help your body heals.
Perfect. All right.
Yeah.
Very good. Thank you so much. Okay, so let's talk about the tummy tuck. Who's a good candidate for the tummy tuck?
Anybody who has excess skin in your belly is a good candidate. But we call it a mommy. It's part of the mommy makeover for a reason, right? A lot of moms, after they've had kids, you can't get rid of the pouch, and so moms are usually the type of patient that we see for tummy tucks.
Perfect.
It doesn't have to be moms, obviously. Can be anybody.
Of course. All right. So, speaking of that, when can I go back to work after a procedure like a tummy tuck?
It all depends on what kind of work you do. But for the most part, if it's not like a physically demanding job, you can actually get back to work within 2 weeks. It's just that you can't, do the heavy lifting and things like that.
Okay, perfect. I just got a banner I can put on.
Oh.
But we'll keep
You
that
can
for
put it
next
on.
time. Should I try to put it? I don't think I can put it on anymore.
No?
I don't think so.
Ah.
We'll keep it for next time. Perfect. Okay. So I'm wondering about the gynecomastia. How do I know if this is a good procedure for me?
It all depends. If you're a weight loss patient and you lost a bunch of weight and then your breasts are saggy, we're talking about men here, then we can do the surgery to cut the excess skin out, right? If you have breast tissues, if you're born with it, or if you're smoking weed that can cause gynecomastia, then we can liposuction some of the fat underneath out, or we can resect some of the fat underneath as well. So it all depends on what's the cause and whether it's skin or whether it's breast tissue excess that you have.
Perfect. Okay. Very, very good. Thank you so much.
Mm-hmm.
So yes, we have options for men, of course.
Yeah, men need surgery, cosmetic surgeries too.
Of course. All right. So I heard you actually need a good iron supplement. Is this true?
It doesn't hurt. Iron will help you to kind of recoup some of the blood loss that you have with surgery. It doesn't hurt, but it's not necessary. It all depends on how your blood level is before. It's not necessary. It all depends on how your blood level is before surgery, obviously.
Okay. Good.
Okay.
How do you recommend going about the hemoglobin levels and raising them?
The best way is iron supplement if you have low blood level. We get concerned with patients who still have periods, because if you get your period and you're a heavy bleeder, that can be an issue. But that's why we get the blood level before we do the surgery. The best way to really maintain your blood level, we do offer Cell Saver. That's when we collect whatever blood we lose and then we put it back into you through your IV. Number one, it preserves your blood level. Number two, it makes you feel better after surgery. Or the other way, you can do ahead of time, take iron supplement. Just remember, the iron can cause you constipation, so make sure you take stool softener with it.
Okay, great. And actually, so we're talking about the Cell Saver, and then we actually got a question here about it. Do all I think you said patients have to do the Cell Saver?
No, not all patient needs the Cell Saver. Like I said, if your blood level is a little bit low to begin with, I do recommend it. Or if you just had a heavy period, I also recommend it as well. If you're an older patient, I think that will help a lot. Or if you've got other medical conditions that we need to keep you in optimal condition, then yes, I think that's a good option to have. think that's about it.
Awesome. Okay.
Yeah.
Very good. So.
Oh, also for patients who are a redo for liposuction. If you've had like a previous BBL or previous liposuction and we're doing the second or third time, there's a higher risk of bleeding, and so I would recommend that for patients that we're doing a redo on.
Awesome. Okay.
Yeah.
I learned something. There you go. That's awesome. Very good. Okay. So hopefully that answered your question, this girl Ria. If you have any other questions, please go ahead and let us know. She says thank you.
You're welcome.
All right. Perfect. Okay. So a few more questions and let us know. She says thank you.
You're welcome.
All right. Perfect. Okay. So a few more questions here and then we'll let you go. All right. What is the number one thing I need to do in order for my results to last?
Different type of things. We talked about massages. We talked about following directions, about not, for example, for BBL, not sitting on your butt too early or too long, and also make sure you keep up with your nutrition. I think that's important. Make sure you eat high protein diet. Stay away from high sugar processed foods. As with any healing process, you just have to make sure you're healthy, right? That's probably the most important thing, and keep moving.
Perfect. So you want to take care of your results for sure.
Yeah, you're spending money for these procedures. You want to make sure you maximize your result.
Of course. Perfect. Thank you so much. All right. When will I be able to fully see my Lipo 360 results?
Usually for any surgeries, you should give at least 3 months. That's when all the inflammation is gone down, and that's when you start to see the shape. Okay.
Perfect. So don't get impatient. She says it's been 2 weeks.
Oh, 2 weeks? That's too early.
But do not worry. Okay, that's
Yeah. It takes a while for the inflammation to go down.
Perfect. Okay, so Dr. Dang, I've been feeling really bad about my stubborn fat.
Oh.
What areas can be targeted with lipo?
We target anywhere you want it to be. Usually the belly, the waist. Those are like 2 areas that people are concerned with the most usually. But anywhere.
Perfect.
Arms, thighs. Yeah.
This.
The chin too. Yes. Chin. Anywhere.
Perfect. All right. So before we go, if you guys have any last minute questions, go ahead and ask. Okay, last chance to ask. Let's really quickly talk about his Black Friday deal. Okay, so if you guys are interested in a tummy tuck, he has an amazing Black Friday deal. As I said, it was $3,500 for a tummy tuck with Dr. Dang. So if you're interested in that, take advantage. It is only for a short amount of time. So there you go. Full name and number here, and then we will contact you. Okay, so you get that free consultation with Dr. Dang. One last question, Dr. Dang. Where can we find you one last time?
You can find me on the Icon Cosmetic Center Instagram page. You can follow me on Instagram as well, Dr. Kwok Dang. You can search for me on Google.
Okay, there you go. You famous.
I don't know, famous. I don't think so.
All right, perfect. And then also, which location are you located at for everyone to know?
I'm in sunny Miami, right by the airport.
Perfect. So in the Miami location. All right. Well, thank you so much, Dr. Dang.
Thank you for having me. It's been fun.
Yes, it's always great having you here. All right. So we will hopefully see you soon again.
Yeah. If you have any questions later on, you can always contact us. Okay. Anywhere, whether it's with Icon Cosmetic Center or with me.
Perfect. All right. Thank you guys so much. You have an amazing rest of your day. Thank you.
Hi everybody. Have a good holiday season.
Yes.